munsi tugiye kuvuga kuri significance and preliminary investigation of signs and symptoms that are presented by patients who come in the urological department. So the first sign, or which may be also the symptoms, the patient will be presenting with, it is hematuria. So what we really like to know about hematuria. So definition of hematuria, it is said when you are able to detect between 3 to 5 red blood cells. In this case, you can say that the patient has hematuria. But hematuria can be defined as visible hematuria or non-visible hematuria. So visible hematuria, both the patient and doctor are able to see red or pink urine with naked eyes. So this is where hematuria can be both sign and symptoms. So there are various causes of the visible hematuria, but the most common source of this type of hematuria, it is acute glomerulonephritis. So when it is not visible, then it is known as non-visible hematuria. Non-visible hematuria can be classified also into symptomatic non-visible hematuria and asymptomatic non-visible hematuria. So when they say symptomatic non-visible hematuria, it means the patient has frequency, has urgency, and has urethral pain, unavoiding or suprapubic pain. These are what are known as lower urinary tract symptoms. So patient come with either visible hematuria or non-visible hematuria. So that non-visible hematuria can be symptomatic or asymptomatic. The other type of hematuria, it is what is known as transient microscopic hematuria, may occur following rigorous exercises or sexual intercourse or from menstrual contamination. These are the common cause of hematuria. So when the patient says that I have hematuria, you have to ask yourself, what is the source of that hematuria? It can be kidney, it can be renal pelvis, it can be ureter, it can be urethra. Or it could be the cause, it can be cancer, it can be inflammation, it can be stones, it can be infection, it can be trauma. So all of those factors, you do have to investigate, you do have to react accordingly depending on the presentation of the patient. The other significant symptoms that the patient will visit a urological department for are known as lower urinary tract symptoms. As we mentioned before, lower urinary tract symptoms include frequency, urgency, urethral pain, and suprapubic pain. But this pain can be, or these symptoms can be caused either by urological organs or other organs which are near to those urological organs. As we saw in the video of anatomy, we found that as these nerves which supply urinary bladder are the same as the nerves which supply rectum, are the same as the one which supply uterus in women. That means someone may have these symptoms not because they are coming from urological organs, but also they may be coming from, for example, rectum. They may be coming from uterus. So it require further evaluation, physical exam, careful history taking to be aware where is the source of this pain or the symptoms that the patient is presenting. So the other source or something that you need to be aware of for the patient with lower urinary tract symptoms is what is known as lower urinary tract symptom associated with neurogenic disease. So the patient will be coming with back pain, sciatica, in addition to these lower urinary tract symptoms. So you have to investigate further so that you could know what is going on in this patient. The other symptoms that the patient will be coming with is what is known as nocturia and polyuria. So nocturia is defined as when someone is urinating more than or waking up to go to urinate more than 2 times during night. So but we say that someone has polyuria when he or she have urine output of more than 3 liters per 24 hours. There is other term known as nocturnal polyuria. This nocturnal polyuria, it is when someone urinates more than 1/3 of 24 hours urine output from midnight to 8 a.m. This is the definition according to of nocturnal polyuria according to Oxford Handbook. This is so. As someone comes with nocturia and nocturnal polyuria, you do have to think or classify these symptoms because it may be urological symptom or non-urological symptoms. So urological symptoms include BPO, or benign prostate obstruction, overactive bladder or incomplete bladder tying. So there are also non-urological causes which include renal failure, idiopathic nocturnal polyuria, diabetes mellitus, someone with hypercalcemia, someone with autonomic failure. Those are also causes of nocturia or polyuria. So the other symptoms complaint that urological patient will come with, it is known as loin or flag pain. This flag pain can be caused by stone, can be caused by something else which is not stone. So you need to classify it and to evaluate the patient. It can be acute, just comes suddenly, or it can be chronic. Acute can be tumor, it can be ureteric pelvic junction obstruction, it can be an infection. So you need to evaluate all these culprits. So there are also some mimics which may mimic this colic pain of the stones. So there is urinary incontinence. For urinary incontinence, you do have to classify. Is it incontinence which comes because someone has lifted up something, which is known as stress urinary incontinence, or it is incontinence that happened just a patient experience kind of fearing to go to urinate, but just after that short moment of feeling that there is a need of urination, the patient directly expressed this incontinence. So there are also mixed form of both stress urinary incontinence and acute urinary incontinence. So we'll be going through all of these. So there are genital symptoms which can be acute or chronic. So these genital symptoms need to be evaluated carefully, and you need to make differential diagnosis, because someone with testicular torsion and someone with appendix torsion, or someone with tumor in this region, they will be presenting maybe with pain, but it will be caused or related to different reasons. So you need to evaluate all of these. The other symptoms the patient will be coming will be related to abdominal part. So you need to do abdominal examination in urological disease. So let's say that someone has a mass in the kidney. This mass might be palpable, especially on bimanual exam. So on bimanual exam, you put one hand on the back of the patient and other hand on the abdomen, so you can feel that mass in your hands, which is different from hepatic liver disease, which may also lead to hepatomegaly, or which also may be different from splenomegaly, because the difference between the masses from kidney and masses from hepatomegaly or splenomegaly is the fact that the mass of the kidney, you can go above them, but for the mass of spleen or liver, you cannot go above them when you're palpating or when you're doing physical exam. So the other preliminary investigation that need to be done in urological patient, it is digital rectal examination. So digital rectal examination, you need to look for consistency, size, and also you need to look for regularity of the prostate gland, because when the prostate gland is irregular, it may tell you that maybe this is not a benign, it may be malignant tumor. If you palpate for the sulcus, which separate the right and left lobe of prostate, and you cannot feel it may warn you that this patient may be having malignant. So physical exam, this digital rectal exam is pointed in a urological examination. So the other part is lapse in the groin, which can be hernia. The difference between hernia and the lymph nodes that you have to be aware of, it's the same concept as abdominal masses. Hernia, you can not go above them, but lymph node, you can go above them when you're palpating them. And other thing that you need to find is reducibility when the hernia has not been incarcerated, but also you have to think about expansibility, very important, because when someone strain, you can find that hernia is expanding, which is different from lymph nodes, because lymph nodes will not be expanding as someone straining. But there is other defect which may happen at the level of saphenous vein at the lower at the part of the upper thigh, middle part of it. This, when saphenous vein has that defect of expansion, also it may extend or expand during straining, but you need to differentiate it with this hernia, because you may either use ultrasound. Ultrasound, of course, you will be seeing blood moving in the saphenous vein, but also a physical exam could have to differentiate all these kind of labs which may go in the groin region. So also there is labs in the scrotum, which may be hernia, which may be hematoma, which may be hydrocele, or some may be associated with pain, other not. So this is the symptoms or sign and examination that you need to be aware of. So as we be going through each purport presentation, we be meeting of all of these concepts, and I hope this video will be recording what I've been talking about during this presentation. Thank you so much. Have a wonderful evening.